I became a doctor because I wanted to connect with people. I believe connection is fundamental to the health and well-being of the patients and providers and systems that we work in. I didn't always know that I wanted to become a doctor, but as I moved through my postgraduate training, it became clear to me that whatever I ended up doing, building relationships was going to be key. I'm a family physician with sub-specialized training in both maternity care and addiction medicine. When I tell people what I do, I'm often greeted with a surprised or even confused look, and something like, wow, those are two very different areas of medicine. But the thing is, they're not, because what drew me to both areas was the opportunity for connection. Over the past few years working in our healthcare system, it's become clear to me that the lack of connection can lead to burnout. I believe connection is the catalyst needed to help physicians and other healthcare providers move beyond burnout and to begin the healing of our healthcare system. As doctors, we come out of our training feeling like our value lies in our productivity, that distance, detachment, and disconnection is how we do our jobs, that the harder we work and the more we sacrifice, the more we can impact our patients' lives. I got swept up into this thinking and started my career in a surgical specialty, training to become an obstetrician gynecologist. This is one of the most intense residency training programs. But after just over 2 years of often working 80-hour weeks, regularly working 24 plus hours on call, it was time for a change. I realized I was more drawn to family medicine. I wanted to develop deeper relationships with my patients, to care for families through pregnancy and beyond, and to have more time to build a family of my own. I made the transition into family medicine, and after the birth of my third child, opened up a practice with 2 dear friends and colleagues. I was so grateful. I felt like I'd hit the jackpot. I had the perfect balance of family practice, maternity care, and addiction medicine. My practice share partners and I would cover for one another, and life and work felt like it was in perfect harmony. Until it wasn't. One of my practice share partners had a devastating family emergency that led her to have to suddenly leave our practice. 2 of us were left carrying the work of 3 busy physicians. We couldn't find anyone to take her place, so for a while we soldiered on at an unsustainable pace. I spent most of my time at work and very little time at home with my young family. And when I was home, I was distracted, irritable. Until then, I'd been wearing busy, like a badge of honor, rushing through my days. But life felt like it was happening to me. I was disconnected. I was emotionally exhausted. I was burnt out. And in January of 2022, I closed my family practice. I'm here today to share my story because I came back after burnout, and not everyone does. And we cannot afford to lose any more doctors to burnout. A recent publication by the Canadian Medical Association found that more than 50% of physicians report high symptoms of burnout. Over half of our doctors are burning out. Something has to change. I believe if we can shift our collective focus from distance and detachment to one of fostering relationships and building authentic connections, that we have the power to transform our healthcare system. Let me show you how. I am a mom to 3 beautiful young children. After the birth of my first child, I experienced crippling postpartum anxiety. I then understood exactly how some of my patients feel in that moment, how overwhelming intrusive thoughts can be, how paralyzing anxiety can be. And now, for me, what feels right is to open up with my patients about my own lived experience. It's through connection that healing happens. Doing so, I believe, also normalizes and humanizes what people are going through. When I was on the other side of the exam table going through my own mental health crisis, the care that my family physician provided me was undoubtedly as therapeutic, if not more, than the medication she prescribed. And during my time as a family physician, do you know one of the most impactful things my patients ever did for me was bring me notes and cards acknowledging the care I provided. Now, it's been over 2 years since I closed my family practice, and I'm not a keeper of things, except for my children's artwork, obviously. But I have kept each and every one of those notes and cards as a reminder of the relationships that we built and the impact I had in their lives. And it's not just in patient-doctor relationships where I believe connection is a catalyst for change, but between doctors as well. A little while back, I was chatting with a young physician, and she was considering doing family practice obstetrics when she graduates. But she was sharing with me that she wasn't sure she'd feel ready and that she still felt nervous coming on call to her labor and delivery shifts. And I said to her, sometimes I still feel nervous on call, and I've delivered hundreds, probably thousands of babies. And I was actually recounting this story to one of our senior obstetricians. And do you know what she said to me? She sometimes still feels nervous on call. But in our culture and in our training, we are not taught to connect and open up and vulnerably connect about what it's actually like to do this work. So all these young physicians and new grads are left out there feeling like they're the only ones with doubts about the care they're providing or uncertainties about the decisions they're making, leaving them feeling isolated, alone, disconnected. And lastly, I want to talk about connection with all healthcare employees. These days, whether you're a patient, provider, or healthcare employee, being in the acute care setting can be really distressing. Emergency departments are overflowing. There are patients in hallway beds, and there aren't enough staff to go around. And if I walk up to a unit clerk and say, I'm looking for this patient, or you ask, how much longer will it be? It's pretty likely they'll be agitated. Understandably, they're pulled in a million different directions with too many demands on the already limited time. But if I take just a moment and say, good morning, it's crazy here. You guys are heroes. I'm Dr. Sarah Lee. I'm on for addiction medicine, and I'm wondering if you can help me find this patient. How long did that take me? Not even 30 seconds. But it can completely transform the encounter. When we see each other as humans first, and take even just a few moments for connection, our experience in the healthcare system, it can be transformed. So what can we do? Building connection back into the healthcare system starts with us. It begins with all of us, whether we're patients, providers, or healthcare employees. Social connectedness has been well established as an incredible risk factor for health and well-being. And I can't think of a better place to start rebuilding connection than within our healthcare system. So the next time you're at your family physician's office or visiting your nurse practitioner, I invite you to take a moment to connect. Simply start the encounter with a, thanks for seeing me today. I know you must be really busy, and watch the interaction change. And the next time you're in our acute care setting, whether for a planned procedure or perhaps just some medical imaging or some blood work, take a moment and acknowledge how hard people are working and how challenging the work is. Thank the food services staff when they come in and clear your tray, the cleaning staff when they empty your garbage can, and your nurse when they're tending to you in the middle of the night amongst all their other patients. When I'm in the emergency department with one of my children, and as a mom of 3 rambunctious young boys, it is not an uncommon occurrence, I'm immensely grateful for the care that we receive, and I thank each and every person we meet along the way. From the triage nurse to the x-ray technician to the physician stitching my kid back together again. The solution to our healthcare crisis, it starts with us. It begins with all of us. Human connection is the most potent prescription I can offer to begin this transformation. We can all play a part in healing our healthcare system. Thank you.